You're listening to the Patient Advocacy Now podcast, presented by Greater National Advocates.
It's just gut-wrenching sometimes. Like, if it's sad and they're crying, I might cry.
Amazing how many doctors do not even want to treat somebody who has Medicaid.
Medical system is about making money.
And I said, so are you hiring more nurses, or you're just telling each nurse to work harder?
Dr. Nancy, thank you so much for being here.
Thank you, John. I'm really excited to visit with you this afternoon.
Me too. I would love to kind of jump in, and you have a bit of a unique kind of entry into the advocacy space, coming in from the pharmaceutical world. Do you want to kind of go into where you discovered advocacy and how you decided to kind of go down that road?
Well, pharmacists are considered an advocate of their patients. When you're in healthcare, you kind of just take on that role. And I consider pharmacy to be the heart of our healthcare system. Everything funnels through there, whether you're between the doctors and the client and patients, the hospital system, everything will funnel through pharmacy. And so we get our finger on that heartbeat. And as the pharmacist, we have been doing these healthcare action plans in our consulting from day one. That's what we're taught about. So all of these years that I have been working with my patients, and we outline where to go from here, and maybe, things we're going to try or not, and talk about what doctor's appointments are. We're setting them up on these plans for success just through our one-on-one counseling. So it has been in the blood since the beginning. And now it was an easy transition to move from behind the bench to in front of the bench. And, that push to shove finally came when I had clients saying to me, patients at the time, I would see them outside of the pharmacy. And they would say, oh, I saw you the other day and I thought about saying hi, but you just look too busy. And it just broke my heart. I was like, no, I'm really here for you. You're the reason I'm here. I want to talk with you. I want to know how things turned out with the family vacation that you took, or, how are you doing on these changes that we've made? Show me pictures of the grandkids, your new grandbaby. You need to have those connections. And when I started to realize that those connections were fading and my corporate demands were increasing, it was no longer for me. I knew that I needed to be able to devote the time and really step into a collaborative union with my patients. So that's when I decided to make that move over into advocacy, independent patient advocacy, because I'm bringing along this unique perspective of pharmacy and how to maneuver through our healthcare system. So that's kind of where the background comes and what made that transition and what allows me to be unique in the advocacy world.
Yeah, you mentioned the corporate demands. Do you want to talk a little bit more about that? Was it a time issue? What kind of demands made that so hard to have that connection you were craving?
The biggest demand, and you'll find this across the board, I think, came with COVID. I worked in community pharmacy at the time, and our time became limited. And the fact that we couldn't be always face-to-face with our patients anymore. And then we kind of lost some of them through the cracks. And then when we became the immunizers, then we had the demand was immunize. So then those that also had all of these other conditions or missed other immunizations or anything like that, they kind of got pushed to the side. And I don't think it was intentional. I see it happened all across healthcare. It just did, because COVID demanded so much from everybody. And when that kind of hit on top of everything else, I thought, I am not serving my patients to my fullest this way. So I need to step away from here.
Yeah, that makes perfect sense. So, is independent patient advocacy something you just started from in front of the bench kind of recently with COVID, or did you kind of dabble in it beforehand?
So I dabbled in it a little bit beforehand. I actually started my business in, I guess, you could say with family for,
Yeah, that's how most
it is.
advocates start.
It is. So
Yeah,
even though I have
yeah,
all of this advocacy experience with my patients, as our parents are aging, I became my ideal client. I am the child of the aging parents with health issues. And when my father-in-law ended up needing to have some major surgery that he thought was going to be just a minor in or out, not realizing the procedure, and my family members who were taking care of him, and they were at a loss. So then I'm like, okay, let me step in and take over this and guide my family through this situation. So there's been a lot of that. There's also been, as we worked with our grandparents as they aged, so I've been dealing with helping family members for a number of years. But it was shortly after COVID that I was like, nope, I'm incorporating the business. And then I don't care if it's free or charge right now. I'm just going to get this behind me. And then I'm opening the doors. So I really made a really hard push in a short period of time to get out there because I'm needed. I know I'm needed.
yeah, yeah, absolutely. And you mentioned that you had pharmacy in your blood. I remember our team before the interview. Are you a second generation
I
pharmacist?
am. I am. I grew up in a little bitty town where we had the corner drugstore, and my father is the pharmacist, and so I grew up in that. I watched it. I was able to learn from him. He was really my mentor in moving into pharmacy, and he gave me, you know, great advice and taught me along the way so that when I went off to college, I already had a really good background. So
Yeah, that's a huge
it was a
advantage.
huge
And clearly
advantage.
you clearly had a lot of affection. It's not like you ran away from your dad's profession; you ran towards it. So clearly there was a nice inspiration there too. That was
So
nice.
can I tell you a little story?
I'd love
Okay.
to hear a story. Sure.
So speaking of being, inspired, this is my inspiration story. When I was young and I just went to work for my parents, which when you go to work for your parents, child labor laws don't matter.
Right.
So
Right.
they start you out as the janitor, you sweep the floors, you empty the trash. And so I did when I was preteen, and that's what I was doing. And I would go in after school and I would work. And I would watch my dad interact with his patients. And I would see people come up to the pharmacy bench. Some of them looked dejected, some of them angry, some of them just sad. And they would hand the prescription across the counter to my dad. And as he took it, he would smile at him, maybe tell a joke, or open it up so they understood that he was listening. And as he just filled the prescriptions, he would just talk with them wherever they were. And, he just had this innate ability to understand what they needed at that time. So when he was done with his prescription, he'd step down from the bench and he'd go over to them and he would have a private consultation. I would usually see he'd put a hand on their shoulder, or, some would be a hug. I would hear some laughter, or, see smiles. There would always be a handshake at the end. And then those same people that I watched approach the bench left the bench differently. They were smiling, they might be laughing, they, had a different demeanor. And I watched this time and time again. And so after one left, I went up to my dad and I asked him, I said, Dad, what is this process? Because when I see those people come in and they leave so differently, what is it that you're doing? I know you can't tell me what you're doing, but what is it that you're doing? And he said to me, he says, Nancy, he says, you have to understand that your empathy, compassion, and your sense of humor are just as much medication as pills and creams. And he told me, he says, you remember that we are not just dispensing medication to these people, we are dispensing hope. And that has stuck with me ever since then. And I have taken that with me all these years. I remember it when I am talking with my patients. I remember it when they've got issues or when they're happy or whatever, that what I'm handing them isn't all of it. I'm part of it. So what I'm giving to them is part of their medication. And so I have said, I'm in the hope business. And I take it from there because I am dispensing hope in addition to all of my advocacy services. It's all founded in that hope. So that's my story.
It's a great story. I love stories of people being inspired and learning. And you're right. I think that one thing that we can never use enough. We can never get enough of in the medical space, in the healthcare space, is empathy and compassion. Those are key things that always make it better, always make it easier to move forward. Who do you typically help on the advocacy side? What do your clients look like?
So my clients look like the busy professional. And when I say that, that looks like so many different people. So these are people that they're all hopers. I call them hopers. So some of these people may be ones who want to avoid a healthcare crisis. So I work with them to create healthcare action plans that help them avoid certain things. Might be doing advanced directives. It could be putting together a schedule and we work a lot on if-then kinds of scenarios so that they have a plan. If this happens, this is the plan. I also work with those that are currently in healthcare crisis. They come to me and I'm like, this is the crisis. Okay. So your goals are what out of this crisis? So we work together to create a plan. We implement that to get them from their current crisis to relief. I also have the hopers that have seen a situation, or maybe it's a new diagnosis that they have already seen before, maybe with a family member, and they don't want to end up that same way. So, for instance, here's a really good example. I had a client, Lisa. Lisa was just diagnosed with prediabetes, and she has watched her father, who has type 2 diabetes. It's totally uncontrolled. He has had so many problems, and she does not want to end up where her father is. So I worked with Lisa to create a plan to bring about different outcomes, to help guide her and steer her in a direction she wants to go, and hopefully reverse it. She's in a stage where we can reverse type 2 diabetes. So that was the goal. That was there. So because she had seen it, she knew it was possible, but that's not where she wanted. So we work with a plan to do that. So each one of these different types of individuals and families, because you have to remember, it's not all individual. A lot of them have that lovely family support. They're not all solo agers, even though many of them are. So it's a personal care team that we have to create and work within. And that's one of those things that I do. So that's kind of what the people are and people look like. And so everybody, their ultimate goal is to have that best quality of life, but it looks different to every one of them. But they all still have that commonality of hope. They're all hopers. It just is what is their goal, what is they hope to achieve. And that's what we work from. So we create what that hope is, and we move from that, create that foundation, and work from there.
And you're talking a lot about personal healthcare action plans. They sound like they're just that, personal. So it really depends on what someone's looking for, and then you make the plan from there. It's individualistic to that goal.
It
Am I
is.
kind of understanding it right?
It is. So like I said with Lisa, her goal was not to end up like her father, and if she could reverse that type 2 diabetes, that pre-diabetic diagnosis, And so we made the plan. If that's her goal, here is your personal plan to get there.
And the plan would involve everything from pharmaceuticals to diet and exercise, lifestyle
It
changes.
does. So, a lot of those things that are in the plans it's a guideline that we put together that contains provider coordination, maybe care coordination. It's definitely going to have collaborative deliberation. We've got to talk through those shared decision-making kinds of issues. We need to look at medication management. Do we need to have disease state education? And in Lisa's situation, we did. She didn't get all that information from her doctor. She just got here's your diagnosis, and I want to put you on this drug. Okay, that happens all the time. But that wasn't her goal. She didn't want to just have a medication thrown at her. She wanted to be able to, okay, I don't want to go down this route. So what do I need to do to not? So there's that personalization. What is it you want to achieve? So how are we going to achieve it? And it takes a lot of different tactics within that plan. And then we implement it. If you want to have that, let's say for Lisa, if you want to have that diagnosis reversed in 6 months, okay, here's our plan. This is our goal. This is the time allotted for us to attain it. And this is what it's going to take. These tactics are what it's going to take to get there. Now let's do them. Let's prioritize them and do them.
I like that. Very action, tangible, solution focused. It's exciting, as opposed to kind of this inquisitive, well, maybe this and that. It's probably empowering for someone to have a plan in black and white, for them to say, this is what I'm doing.
It is. My goal in this is to be able to provide them with that confidence and control to navigate that situation. That's what this brings, because when people when they don't know, and they lose that control, or they feel that they are, and they aren't confident in how to regain it. We all know how important that is to us. We all want to have that control of our own body. We want to have control of our own decisions. But sometimes we just get really overwhelmed. We don't know where to start. We don't know what we don't know. And so then we're not sure what the steps are. So that is what I bring. I am able to give these people confidence and control with hope as their foundation of these plans, so that they can move forward. Whether they choose to hire me to implement it, or they feel that they can do it themselves, that's my goal. Okay, I've been able to empower you. I've been able to give you back your control and your confidence, and it's all based on your hope. Perfect. That's what I'm here for.
Yeah, absolutely. As a pharmacist, do you mind if I ask you some questions related to medicine? And because I have some things that are kind of poking around in my brain.
Well, possibly we could see about that.
Yeah, well, not personally, but I noticed that there's, as I get older and my parents are getting older, there are a lot of medications that kind of come in and out of somebody's lives. of somebody's life. What is your kind of advice for how to manage medication properly? Are there times where you see that people are on medications they no longer need? I found that to be the case with some family members. And how do you kind of wrap your head around it? I mean, obviously, I think, what's the term? Is it polypharmacy, where you have more than one or two medications
Yes.
that you're kind of dealing with? It's and then they start interacting with each other. So what's a good way to kind of wrap my head around it, or anyone listening?
Well, that's
for
an
that
excellent question, and I'm glad you asked that because I could preach all day on polypharmacy.
Did I get it right? Is it called
It is called
polypharmacy?
polypharmacy. And what that means is that you're using multiple medications to treat the same disease state. Okay.
Okay, gotcha. So if you have, if let's say you have, I don't know, migraines and an issue with diabetes, those are different. So if you have two different medications, that's not polypharmacy. Right. But if you're taking several medications for diabetes, that's polypharmacy. Yes. Okay, it is. Just wanted to make sure.
And let me preface this by saying polypharmacy is now, in some instances, is becoming the standard of care. And the reason that's happening is because they're finding that through the mechanism of action of these drugs and using different mechanisms of action together, they are able to treat better. All right. So it's not uncommon for, let's say, a diabetic to be on an oral agent and maybe an injectable agent and also maybe insulin. All right. So they are finding that they're able to control that person's type 2 diabetes and keep their A1C down with polypharmacy of 3 different ones. Okay. The problem we get into is if nobody's really paying attention, maybe we end up with 2 medications of that one class. And now we're having problems and nobody's really looked at it. Maybe we have a patient with dementia, beginning dementia, who the doctor changed them from one type of injectable to another, and they can't always remember, so they're injecting the previous one. They run out of it, so they start the second, yeah. Or I inject this one at one time and this one at another. And right. So one of the best ways to always look at this is there are times of year, definitely, when you should always do a medication reconciliation. And that should be at least annual at your doctor's appointment. Okay. Everything should be reviewed. If you go to your doctor more often, fine, have them review it. Okay. Anytime that there is an addition of a medication. All right. So it's not uncommon to have medications come in from specialists, from PCPs, maybe from an educator, a specific type, licensed educator, or also, you have to take a look at too. You've got those that are dealing with the health of the body, but you also have the health of the mind. So you have psychiatry that's also prescribing. And if they are not paying attention, which it's really hard to keep up when you have so many prescribers, adding a new medication, having it checked against everything else, that doesn't happen all the time. And that's where we can run into problems. So anytime you're adding a medication, it's always good. Anytime.
So once a year, or when you're adding medication, when
there's a transition of care. And I say that as in a transition of care is, let's say you're going from home, you've got your home meds, then you're going into the hospital. You're going to compare that. Then you're going from hospital maybe to rehabilitation. All right. You're going to check that again there, because it's very common to lose a medication along the way or end up with doubles, because, so anytime there is a transition, you should be checking all of those medications and making sure that they're going to jive.
That's great advice. So once a year, or sometimes when you see your doctor more often, when you add a medication or in transition, those are the three kind of benchmarks of when you should do a full kind of reconciliation of what you're taking and make sure and you should do it obviously with your doctor, or in your case, is that something you would do with someone as a pharmacist and an advocate? Or is
Absolutely.
that something?
So the pharmacists are very key to that, and they can catch some things that maybe doctors don't, because pharmacists can take that time to do a comprehensive clinical medication review. And so we don't just throw your drugs into the into whatever app we're using, and it says, oh, we may have these interactions or we may have duplications. And yeah, we're looking for that. But because we understand the disease states, and we take into account all of your labs, we take into account scans, we take into account glucose readings for a length of time, blood pressure readings. We even take into account, has you had certain immunizations, and some of those can interact, just how a person is going to metabolize it. We're also looking at the age of metabolism, because that plays a huge effect on absorption and discretion, and when you actually excrete it. So there's a whole lot more that a pharmacist can do in depth, and we're trained for that, and we look for that. And as a pharmacist who works with seniors, I have the background in geriatric pharmacy, and to be able to know what I'm looking for and how that's going to change as they age. So we become really essential team members on the healthcare team, because more and more providers are coming to us pharmacists for this type of review. I don't have, I'm wondering about these things that people are telling me. My patient is telling me this. Can you please do a review on this to see if it's medication related, or what are we looking at here, to maybe even rule that out? So that is really becoming more and more of a popular team approach, which I'm really glad to see. So yes, and honestly, family members can reach out to pharmacists, say, I wonder if this is what's causing my spouse, to act this way. All right, I noticed this probably 6 months ago. I don't know if it's a new medication. I don't know what it is. Can you help me look at this? And absolutely, we'll look at it. We'll perform those reviews. We'll help, either find an issue or give peace of mind that there is no issue. Mm-hmm.
That's great. You mentioned, or in your bio, I read that you do a lot of speaking and I'm kind of curious what topics, especially for employee wellness programs, what kind of topics you speak about that kind of apply to, a workforce, because this sounds so personal and so individual. How does it translate to the corporate environment?
Thanks for asking that. Yes. So what I do is, because we have this whole generation of caregiver employees, there are over 10 million caregivers 50 and older who are caring for their aging parents or older loved ones, but they're also still in the workforce. And 70% of that workforce is doing this dual role. I'm the caregiver and I'm the employee. And we're finding that these employees are having to make work, care, life decisions daily. They have to ask themselves, is today going to be a day where I work or I give care? And that really affects them personally. There's lots of disadvantages that are happening to them, but it impacts the employer also. Anytime, like for instance, on average, 3.2 days of work a month are missed by a caregiver employee. Okay, is that unpaid leave? And now they've had a huge hit to their pocketbook? Or did they get PTO? And now that's extra PTO that the employer has to pay. Because they're not there, they're not being productive, and their coworkers are having to pick up the slack. So we also have morale issues that happen with this. So what I do is I bring workshop solutions in through the employer to the employee. And those workshop solutions are designed to teach these employees how to navigate the healthcare system. So for instance, we were talking just a little bit earlier about the polypharmacy. All right. So polypharmacy and the hidden dangers in that older adult population is one of my signature workshops. And so I come in as an education for the employer, speak to the employees, and I teach them what to look for. I teach them how and when they need to be looking at things for their older family members. We talk about causes. We talk about, causes of polypharmacy. We talk about the dangers of it. We talk about how then best can you alleviate that? How can you help make this better at home? Because if you can make it better at home, then you can make it better for yourself at work. And we see this in that if caregivers learn how to coordinate home care, all right, I talk about that in one of my signature workshops. If they learn how to coordinate home care, great. Then maybe they can be at work more often and absenteeism goes down. I teach employee caregivers how to, with confidence and control, set up their routines at home for their loved ones. All right. So they have a control with that. They've got everything they need set, whether it's people or different situations. Maybe it's certain reminders. Maybe it's callers, whatever it is they need so that they feel confident and in control in the home situation. Great. Then they can be more productive and focused at work. So there we're reducing that presenteeism and we're increasing productivity. All right. I teach them to learn how to navigate and tools that they can use to reduce caregiver burnout. That's huge. So if they experience less caregiver burnout, then they're going to have better mental health and it's going to improve company morale because they're much happier at work because they've learned how to take care of certain things at home.
Yeah, I mean, it makes perfect sense to me. If you can make a healthier, happier workforce, they'll be more productive at work. There'll be less issues with churn. Your other workers will feel more energized because their team is whole. There aren't people missing suddenly, and you have to pick up the slack. So it helps everybody.
It does.
It makes perfect
and
sense.
so by teaching them, and it's great that when the employer becomes part of the solution, everybody benefits. So by the employers or organizations, it can be organizations, groups, it doesn't matter. If then let's work together to bring this information to your people so that they can take this home and make it work for them. Because if they can feel confident and controlled with the home environment, because that's what's causing it. They come to work, their mind is still on the situation at home. 11% of productivity is lost just because people can't stay focused at work because they're so worried about whatever the home situation is.
Yeah, that is huge. I mean, 11%. I mean, that's huge.
And so if we can get that back, it's important to the employee and the employer. I mean, this is just two sides of the same coin, when we're talking about this. But I tell you, employee caregivers don't have to choose. Do I work or do I give care? Because employers can bring in solutions. And these caregiver employees can have both. They don't have to choose. They can have a safe and nurturing home life for them and their loved ones, and they can have a productive and rewarding career. You know, when employers step up and become part of that solution and bring that in, everybody benefits from it. Because I can tell you, there are a lot of people out there caring for an older adult. You know?
Absolutely.
So,
Well, Dr. Nancy, if someone wants to have you speak at their company or organization, or if they want to reach out to you for some advocacy services, what's the best way for them to get in touch?
two ways to get in touch with me. One, I am always available through LinkedIn. So you can message me, connect with me, whatever you'd like to do. I am Dr. Nancy Taylor on LinkedIn. Also, you can just drop me a message at nancy@drtadvocacy.com. And that is drtadvocacy.com. Those are the easiest ways to get in touch with me, and be happy to explore how these workshop solutions could empower the caregiver employees.
I love that you're giving, hey, just email me, just message me. It's not, hey, go to my website and read 17 pages of a brochure. It's like, just reach out and connect.
Exactly. Reach out,
That's
connect.
So great.
Let's just, let's talk about
Start the conversation. Right, exactly.
it.
Well, Dr. Nancy, thank you so much for being on the Patient Advocacy Now podcast. It was an education and a half. I really appreciate it.
Well, thank you so much for having me. I could just continue to talk, but I know our time is limited. I thoroughly enjoyed this.
Thank you. Thank you.